Okay, everyone, we've got Dr. Ryan here on the air, ready to talk about COVID-19 in a little more depth than he was able to with the county commissioners. Welcome, Dr. Ryan.
Thanks, Mark. Good to be back.
I suppose, as we do every time we talk, we should review again the grim statistics that are facing us, if you wouldn't mind.
Yeah, absolutely. Let me pull them up real quick. So we're headed in the wrong direction, is the story in a nutshell. Currently, half of Americans are unvaccinated. And what are driving the current increase across the country, that and the Delta variant in combination. So case count across the country, we are seeing a rapid increase. We're now at a little over 85,000 a day as a 7-day average across the country. Hospitalizations have also seen a 32% increase over the last 7 days. Fatalities, we're now at 769,000, and that number is outdated. It's actually more than that now as we speak, with an average 388 per day. That's also climbing as we speak. And then here in Colorado, similar. Over the last 4 weeks, our case count has grown every day. We are now at 798, so almost 800 a day as a 7-day average, with our 2-week cumulative at 171 per 100,000. We've seen almost a 12% increase across the state in hospitalizations over the last week. And currently 82% of our total hospital ICU beds are in use. So there's roughly a little over 400 individuals hospitalized statewide due to COVID, and almost all of them are the unvaccinated. So right now across the country, 99.999% of those hospitalized or dying or dead in the last several weeks are all unvaccinated individuals. So your risk as a vaccinated individual is 0.0001 of dying or going to the hospital. If I was a betting man, I would take those odds in my favor. Here in Clear Creek County, we've had 14 cases in the last week and 22 in the last 2 weeks for a sum total of 508. Our 2-week cumulative incident rate is at 195 per 100,000, so almost 200. Our test positivity rate is up at 8.3%. Major contributing factors, the unvaccinated and the Delta variant. It's an absolutely losing combination right now. It's what's fueling the entire increase in cases across the country. So if you're unvaccinated and you want this to end sooner than later, is literally all on your shoulders, because you and you alone are driving this pandemic and this surge that we're seeing right now. So that's pretty much an update on the numbers. Vaccine efforts continue. We have a clinic. The county has a clinic every Wednesday. And Safeway in Idaho Springs has vaccines 7 days a week. So if you are not available at the middle of the day, as some have suggested, you can go 7 days a week at your leisure and go get vaccinated at Safeway in Idaho Springs or the Walmart in Evergreen or the Safeway in Evergreen. So there's really no reason or rationale for why you wouldn't get vaccinated from a convenience perspective at this point. As far as testing, we're continuing to test. We test every Tuesday from 10 to 2. The reason we haven't expanded, and I know some people would love to see us testing every day all over the county, there just aren't resources for that. And again, this is all being driven by the unvaccinated. So if the unvaccinated were vaccinated, we wouldn't really need much testing at all. And historically, over the last several months, we've only had a handful of people come to our testing sites. So to have multiple testing sites many days a week around the county financially makes 0 sense. We're basically paying people to sit in a parking lot for nothing because the unvaccinated weren't showing up. Now there's a little bit of fear in them because they're actually getting COVID now, and they're starting to show up at the testing site. But it doesn't necessarily justify, and as I stated on the BOCC call, It is the state that is determining the contract with the COVID Check Colorado, the testing site group. So we're not dictating where they are and how often they're there. It's the state that's doing that through their contract with them.
Okay, got it. And now, I just wanted to remind people that if they come for a vaccine on Wednesdays from the county, that is free. That's that four-letter word that starts with F that we love so much, free. And additionally, if you go to Safeway, free. If you go to your doctor, free. Anywhere that you receive the vaccine, it is FREE. So I'm glad that those are out there, and I just want to say I'm so happy to hear you call this surge for what it is. It is a pandemic of the unvaccinated. That it's just as simple as that. There's no other explanation. And by the way, looking at the chart of cases, the daily cases going back to the beginning of the pandemic, we are actually at a number that's higher than last summer when we had that incredible surge of cases, and that was before there was a vaccine. So the caseload among the unvaccinated is it's a wildfire right now. It's just unbelievable, and I think that has a lot to do with the number of people that you can transmit this to. I know there's a term for that. It's escaping me right now, but I thought the original COVID, every one person transmitted it to 1.5 people or some such number. And I think I saw every one person now is transmitting to 5 others. Maybe you could clarify that for me.
No, that's exactly right, Mark. The original virus, the original Wuhan virus that came over from China was the rate at which you could transmit it to others was roughly 1.5 or 2 individuals. That now has more than doubled, and that is due entirely because of the Delta variant. It is far more transmissible. You're going to have much stronger and bigger symptoms than you would if you received the original virus or gotten the original virus. So your potential as an unvaccinated person to spread it has actually increased from the original virus. This is what we've been warning about for a very long time, and here it has come home to perch. So right now the unvaccinated are driving this entire surge that we're seeing right now. Are there vaccinated people getting COVID? Yes. The vaccine is not 100% protective. It's 90 to 95%. But the huge difference is that someone who has what we consider breakthrough case, meaning they're fully vaccinated and they still get COVID, because that is a possibility, they have cold-like symptoms for a couple days or allergy-like symptoms for a couple days. The unvaccinated have a very different outcome. As I stated on the BOCC call, 99.999% of those who are dying or hospitalized right now are unvaccinated individuals, not vaccinated. So any sort of fear you have of getting a shot or a second dose and any mild symptoms you may get from the actual vaccine, which is certainly possible, those go away in a few days. Whether it be a headache or a sore arm, or in Eric Clapton's case, he couldn't move his joints for a couple days. Those are temporary and they'll go away, and they're manageable. COVID is a far more long-lasting and potentially deadly virus than any symptom you could possibly have from the vaccine. So there's really no rational reason why you wouldn't get a vaccine at this point. COVID is completely preventable. And the analogy is car crashes. If you don't wear your seatbelt, you're going through the windshield. And once you're going through the windshield, it's too late to put your seatbelt on. So I would highly recommend you put your seatbelt on now, get vaccinated. That way, when you do get in a car crash, you're fully protected, and your outcome will be 1,000 times better than if you weren't wearing your seatbelt or you weren't unvaccinated.
Okay. Well, I heard you in your Board of Health report speak at length about mask wearing, and it seems so last generation technology at this point with the vaccine to me. But nevertheless, I continue to wear my mask in public. I know it's possible for me as a vaccinated person to carry the virus in my respiratory system and to pass it on to others. And with 100% of our children under the 12 and under unvaccinated, I feel an obligation, at least to them, to try to be as safe in public as possible. And so I think there's some usefulness to mask wearing, but I'm just getting hardcore on this thing about punitive strategies for compelling vaccination. I just think it's time to consider those options. What's your view?
I agree. It's the policy that the school district has adopted, the first in the state that I'm aware of, 4 weeks ago when they decided to do it. And that is, if you are unvaccinated, you're going to need to be tested twice a week, so that we can determine the risk that you pose to the institution in which you work. Denver has followed suit in now mandating among all county and city employees in Denver, either they get vaccinated or they have to wear a mask 100% of the time and get tested several times a week. Right now, mask wearing is effective at protecting yourself and those around you. But a broad countywide mask mandate, as I stated earlier, is very difficult to enforce, particularly in businesses. Obviously, patrons, the businesses don't want to have to enforce things with them. And so right now, mandating it across businesses, mandating it across county employees, mandating it across school districts is really our first line of defense. It's more of a scalpel surgical approach to it rather than the blanket mask mandate across the entire county or the state. But I agree. If people are not willing and able to concern themselves with self-preservation, they need to be encouraged and enticed, and whatever word you want to put in there, to do themselves a favor and get themselves protected and vaccinated. The number of remorseful people who are in ICUs who now want the vaccine, but getting a vaccine in the ICU is about as useful as putting a seatbelt on as you're going through the windshield. It's a little too late and not terribly effective. So now's the time to get vaccinated because, as I've stated a million times, if you're unvaccinated, it is not a matter of if you're going to get COVID. It is a matter of when. And so you can either make the choice and protect yourself and those around you and limit your losses, or you can continue to risk and play the Russian roulette, in my opinion, because the outcome for you is probably not going to be favorable.
Yeah, I'm glad you mentioned the seatbelts because I'm old enough to remember when the seatbelt requirement laws came into effect, and I can't say exactly when that was, but it was around 40 years ago, and there was a tremendous outcry. I'll never do that, blah blah blah, and then when the state decided that you could be ticketed, pulled over and ticketed just because you were observed not wearing a seatbelt. That compelled everyone to finally wear one, and now nobody complains about that anymore. It's just part of the culture. You wear your seatbelt, and the same. It occurs to me that another example is the public smoking ban. I remember when I was a kid, people smoked everywhere. Doctors smoked in their office while they were treating patients. For God's sake, I can remember going into a doctor and he had a cigarette on his lip, and so then these laws came into effect that prohibited smoking in public. Oh my gosh, it was the end of the world, and now nobody thinks twice about it. I just think it's time, if we can't if we can't, through logic and reason, convince people to become vaccinated, there's going to be that hardcore segment that holds us all back from living the free life and letting the economy flow again. If they're going to be stubborn about it, I think it's time for us to take increasingly strict measures.
Stubborn is a very generous word, Mark. I'll say that.
Oh, gosh, Dr. Ryan. Okay, let's just review, if we can, the places where people can receive information. There's the Clear Creek County .us website, and that has all of your current health information on there. And then there's the phone number. Let's see, I could pull that up. Unless you...
Yeah, the COVID vaccine info line is 303 670-7528. That's 303-670-7528.
Okay.
So that's an information line, and I believe you can leave messages on there, and one of the nurses will call you back. Right now, they're quite busy with contact tracing, as you might imagine, and we will continue to do contact tracing 100% of cases as best and as cooperative as the cases are. We will use that as one of our many tools to help slow and stop the virus as best we can. But as I said, the majority of cases now are in the unvaccinated.
Yeah, and as you said earlier, 22 cases in the last 2 weeks, 14 in the last week. That's a higher number than I remember in quite some time. And again, it's completely among the unvaccinated. Get the shot. Dr. Ryan, thank you so much for your time again today, and we'll talk again soon. I'm at your service whenever you would like to come on and speak to the public. Please let me know.
Thanks, Mark. I appreciate it. Have a nice day.
Okay, goodbye. Okay, everyone, that was Dr. Ryan, and as you heard him say, it is now it is a pandemic of the unvaccinated, and if you're not vaccinated, and you can take Eric Clapton, former heroin addict, willing to put anything in his arm, take his advice not to get the vaccine, or you could take Dr. Ryan, Dr. Fauci, and the CDC, the FDA, and the NIH and the State Department of Health, all of their recommendation, and get the shot. So it's up to you, but hopefully not for much longer. I'd love to see some sort of a mandate for vaccination. All of us deserve that. Until next week, here's some music, pre-recorded music for your listening enjoyment.